Welcome to our 8-week Family Caregiver Education Series, hosted by the Central Okanagan Hospice Association in partnership with Vantage Living and Jumpstart Communications. Through challenging times, and especially during this pandemic, we know family caregivers are carrying more responsibilities in caring for their loved ones, carrying more stress with varying restrictions in place, and some having to make some life-changing decisions to be closer to their family. Through this 8-week Caregiver Education Series, we hope that family caregivers will be able to build confidence, resiliency, skills, and learn more about self-compassion and self-care. We call this filling up our toolkits. The Central Okanagan Hospice Association has been providing supportive care programs and services to individuals living with a serious illness and supporting their families along the way for 39 years. This may be through our community hospice visiting program, wellness program, vigil services, or providing grief support. Our programs complement the medical care to bring an integrated approach to palliative care by providing emotional, social, practical, and spiritual supports with trained, compassionate, and dedicated volunteers and our professional staff. All of our services are offered at no cost, so there are no barriers to access our services when and where needed, thanks to the generosity of our community. The Koha Aga Center is located on Cooper Road, and we have a lend-in library full of resources and great reading materials for family caregivers. Today's topic is understanding pain. Pain is what the person says it is, quoted by Dame Cicely Saunders. Today's presentation is by Tara Lee Calhoun. Tara Lee is responsible for clinical oversight and program development for all Vantage long-term care residences. Tara Lee has over 34 years of nursing experience as a registered nurse. She is unique in having worked her nursing career in acute care for 32 years, but truly found her passion in caring for seniors by leading the nursing teams for the past 24 years in long-term care. Although Tara Lee is often on site supporting the clinical teams, Tara Lee's primary work location is at the Kelowna corporate office. Her past experiences as a director of care in long-term care for over 20 years, she has provided strong nursing leadership and ensured best practice outcomes to enrich seniors' lives. Since 2013, Tara Lee has achieved her gerontology certification through the Canadian Nursing Association to better lead the nursing team in providing the best care for our seniors.
I have some really good experience in coping with pain and taking care of loved ones at the end of life. But as Natasha said, my experience overlapped and I went into long-term care. So Vantage Living has 4 long-term care sites, and we have been providing rehabilitative and long-term care at end of life for seniors. So I welcome any questions that you might have around palliative care. This is a 2-stage program that I'm doing. This first one is just really understanding pain and what that's about. And the second one will really be about pain management using medications and alternatives to that. But I'll touch on a bit of that today. So my goal around today is really helping you understand pain and answering any questions that you have. So please use the chat. I will stop at any time and answer any questions that you might have. But I'll also have some spots where I'll ask some good questions. And then we will take a break in the middle just to make sure that you are comfortable to ask your questions away. So some of the things that we're going to cover today is defining what is pain, what is the prevalence of pain in life-limiting diagnosis, some of the common attitudes that people have around pain, and what's the concept of total pain. And total pain involves physical, social, spiritual, psychological aspects around pain. We're going to look on the influences on our perception of pain and some of the consequences that can happen if you're having chronic pain, and some of the signs that you can be observing that your loved one could be having some pain, and other ways to manage your pain relief. So I want to start with hospice care, and it started way back with a lovely lady that was from England, and that is Dame Cecily Saunders. And she was the first modern concept around hospice care. And more than anybody else, she was responsible for establishing and understanding the discipline and around the culture of palliative care. And she introduced the concept about having effective pain management and insisted that dying people dying people needed to keep their dignity and their compassion and respect, and really looking at the methodology around treatment and how we could do it better. She also abolished the prevailing ethic that patients should be cured and that those that we could not cure was a sign of failure, and that it was acceptable or even desirable to lie to people about their prognosis. And she really threw all those kind of old myths out. She also paid attention to the notion that dying people should wait until their painkillers should be worn off. And we know that's not true. And that she scotched the notion that the risk of opiate addiction was an issue. And we know now that addiction is not a concern, and that's something I'll talk about a little bit later. So I want to start with the definition of pain, and very medically wise, it is a localized or generalized unpleasant bodily sensation or complex of sensations that cause mild to severe physical discomfort and emotional distress, and typically results from bodily disorders such as an injury or disease. So it is very much a normal body function that happens. If I pinch you right now, you're going to say, ow. That is a normal sensation. It means your nerves are being triggered, and goes to your brain, and your brain goes, I'm having pain. And then you verbally withdraw and you go, ow. So it's a very normal function that every one of us goes through when we're experiencing some type of pain. So my first question that I have that I'd like you to put into the chat is, tell me some words that you would use to describe what pain means to you or that your loved one is using around pain. So I'll just take a minute and let's describe some of the words you think when you think of the word pain.
One comment is not feeling well. One is unbearable, emotional experience, back spasm. For my mom, it is itching.
Absolutely.
Discomfort.
Those are all great ways to describe pain. What's important when you're describing pain or listening to someone is listening to what they say and how they express it and how they feel about it, and taking that for gospel. Too early in my career in life, back in the early 80s, we were going, I don't think that person's having pain. We were very uneducated in the beginning of our life, of our career. And we've learned a lot around hospice care and around palliative care. And what your loved one says or what they believe is gospel. And we must take it as that and believe them and support them and help them through that. So thanks, that's really good. Some great words to use around pain. So some of the common words that people will use around pain could be that they're having some aching, they could have cramping, it could be that they're feeling fearful with it, some gnawing or heaviness, sometimes it's hot or burning, could be sharp or shooting, and it travels through and it starts on my shoulder and it goes to my belly. So they're able to be very good about describing where that pain is in their body. Sometimes in life, it's just pointing. my good example is I worked in care yesterday and I met a gentleman for the very first time and I introduced myself. And he was in a wheelchair and he only could use one arm, but he had his arm and he was rubbing it back and forth across his belly. And that was my cue to ask good questions. And I'm like, how are you feeling today? I feel good. Are you having any pain? No, I'm not. So as a good person, you're going to go to the next level and go, well, I see that you're rubbing your belly. How's your belly feeling? Oh, I've got a bit of cramping and a bit of heartburn. So it's always not taking that first response and going, oh, he's not having any pain. Always go to what the body's showing you. And he clearly was showing me physically that he was uncomfortable. But intellectually, he's like, it's not that bad. So always look at what you're seeing as well as what they might be saying. So the prevalence of pain in people with a life-limiting diagnosis. I just want to take some experience I have and share it, that over the years, 50% of people that end up passing away from a variety of illnesses, such as cancer or COPD, which is chronic obstructive pulmonary disease, so difficulty breathing, congestive heart failure, a lot of people will have where their lungs aren't working that good or their heart's not working that good. A lot of them, 50% will not have any pain through their life and through their end of their illness. So the myth that many people believe that a dying process is very painful is actually false. That's a false myth. Reality is that some people will have some pain, and the level of pain that each person experiences with the same illness and the same diagnosis and the same age isn't necessarily that we're all going to be the same, because that's the beauty of life. We are humans and we are different. We're not all the same. But most importantly, it's how each person copes with their illness, the support that they have, and where they're at in their illness is how they're going to be able to cope with their pain level. We have come a long way knowing how to provide comfort care. So if your loved one is experiencing pain, the options for treatment is so great and so vast and very effective to ensure that the best care is provided for good pain management. So I want to go on to some common myths that are out there. So when people are talking about their pain, they believe if I talk about my pain, that it's showing a sign of weakness. Or for some of our elderly, they still have that belief that the doctor is the high level. So they never want to disappoint their doctor or their nurses or their family. So they don't want to be feeling that they're displeasing them, so they won't discuss their pain. They also don't want to discuss their pain because they don't want to make you feel bad or make it harder for you to be around them. So they'll keep it more inside and go, I'm fine. As the gentleman I saw yesterday, he goes, no, I'm not having any pain. I'm fine. But actually, when I dug deeper, he really was having some discomfort. Or that people will pity me and that they only think of me as my disease process and about what's going on and not me as a person. So lots of myths out there about why people won't express how they're truly feeling about their pain. So the other part of that is what I personally think about my pain. So a lot of seniors, unfortunately, believe that having pain is a normal part of aging, and we know in fact it's not. I've met some wonderful people in their 90s and 100 years old that get up every day and they don't have pain. So it's not a normal part of aging. That pain could be less important, such as things as exhaustion or constipation. Those are things that could happen if you're taking pain medication, but that doesn't mean that you don't want to have better pain control around that. Or that if you're having pain, it's a sign of the worsening disease or that it's impending, that you're close to death. So they're scared to express that, worrying that this could mean that this is it and I'm getting sicker. And that's not necessarily, it just means that the regime you're on right now, you might have peaked it, we need to try something else. It also is that pain treatment involves over medication and addiction. And I want to have a little nursing moment here is that when you're having pain, you take pain medication and your body needs that. It will use that to send and settle down the nerves. So it's not sending triggers up to the brain to cause the pain. So your body's going to use what it needs. And when you truly have a diagnosis or a disease process that's causing pain, and you're taking that pain medication, there's no worry about addiction because your body needs it. For people that don't have a life-limiting disease and they have a shoulder injury, so they're on pain medication, but then the body goes, hey, I kind of like this feeling. It makes me feel good. So the pain in the shoulder's gone, but they still want to keep taking it. That's where addiction comes in. So anyone that has a life-limiting diagnosis or has a chronic disease, the body's going to use what it needs. So addiction is never a concern when you're truly having pain. So also that the treatment of pain, I will lose control. And that is the biggest fear that a lot of people have, is if I express about my pain, you're going to give me something more, doctor. So I don't want to tell the doctor. So I go, everything's fine. But I go home every day and I'm having a lot of pain. And it's because I'm worried that I'm not going to have the control, because I'm already feeling I'm losing control of what's happening around me. So I don't want the medication to make me literally loopy and not know who I am and know my loved ones. So again, if you talk to any physician or any pharmacist, they always tell you the same thing. It's always start low and go slow. So if we talk of something like morphine, you can start on 0.5 of a milligram or even 1 milligram. You can go up to 10, 20, 60 milligrams, huge range, but you're going to start really low and slow on a low dose and see how that makes you feel. But if that's failing you and it's not working, you know that there's a big gamut more doses. And that's where you really need the doctor and the pharmacist to really help you understand where you're at in your pain control right now, but where you're nowhere near the max dose and you're nowhere near worrying about addiction. So it's really about really good communication and support to your loved ones over that. So I hope that gives you some misnomers of what people think about pain and being able to help them with that and want to be open and honest and communicate around their pain levels. So I want to talk about total pain. As we mentioned, it does have 4 components. It's got physical, social, spiritual, and psychological or emotional. I'm going to go into a little bit of depth on each of these. And as I go through them, if you have any questions, don't hesitate to put them in the chat. And I will stop and answer your questions. And then we're going to take a break just a little bit into this. We'll take a break. So I want to talk back about Dame Cecily Saunders. She created the whole concept of having total pain. And she defined that it's a concept of when someone is suffering, that it encompasses everything. It's about their physical pain. It's about their psychological pain. It's around the social level that they're having. It's also around their spiritual and actual practical struggles. So she really helped us understand that it's not just the pinch on the arm and I pinch you and that's a pain and that's it. Afterwards, I'm going to be upset and angry going, why did she pinch me? And that's my emotional response. So the next time I see that person, I'm going to think, she pinched me. I don't really like her. And it's that emotional response we go through when we're actually having pain. It's not just about the physical, because the physical leaves us pretty quickly. So how does the physical aspect affect our pain? So physical pain is a sensation caused by certain types of messaging being sent through that nervous system. So you have that pain in your belly, that belly pain is achy and it's bothering and you feel bloated and you feel sore, and that nerves goes up to your brain and it goes, hey, we're not comfortable, we're not happy. So physical pain is what most people refer to when they say something hurts on their body, and it's associated with something being damaged. So whether that's an internal organ or whether that's our outside of our skins or our muscles or our bones, it's a communication back up to our brain. But physical pain can be caused by many things and can be described as such as throbbing or aching or burning. Those are all common descriptions that people will use. But physical pain can also be described as very acute. and meaning that it's only for a short period of time and then it's gone, or chronic pain, which can last for months. So as women, we have gone, many of us have gone through childbirth, and we will be able to tell you exactly what it was, how long it was, how bad it was, how you felt, how you emotionally coped with it. But in the end, we're happy because in the end, you would have had your baby. Yay. So it's a positive, even though it was a very painful moment, it ends up being a positive moment. Chronic pain can be something as I'm now in my late 50s and I don't have pain every day. I'm very fortunate and lucky that I do not. Have I broke bones? Oh yes, I know about chronic acute pain. Broke my ankle, very acute pain. Took me a while to get over that. But my husband, unfortunately, has that lovely word called arthritis. He deals with daily pain. It's chronic pain now. He's had it for about the last 5 years now. He's gone through one knee replacement. Now he's heading for the next one. So people live with chronic pain, and that doesn't mean he lives on a pill every day. There's many things that we're using to help him cope with his pain. But that's a sign of chronic pain, that you wake up every day and you have some kind of ache and pain. And lots of people will have chronic pain that are not at end of life, but it's their history of it and their thought of it helps them cope and makes them understand the physical pain. And all you have to do is talk to anyone that has arthritis, and it be a rainy day or a cold day, and you can tell that their pain level has increased. And they really believe that the weather really affects their arthritis and their bones. And whether it is or not, it's what they believe, and we must believe them. So let's talk about social pain. So social pain is caused from social disconnection or rejection. So people with chronic pain often experience social disconnection, and that they're feeling painful loss of relationships and professional roles. So typically we don't think of social pain causing physical pain, but absolutely. All you have to do is speak to someone that's gone through COVID right now, which is all of us at one level or another. We're actually facing social pain right now, from social distancing, not going out to the common areas that we did, like a restaurant or going to the theater, not seeing all our families and keeping our bubble very small. We're all facing on a daily basis social pain. That social pain we're going through, if I turn around now and broke my ankle, that would be a lot worse experience for me, because now on top of the physical pain I'm having with my ankle, I'm now experiencing social pain. And this is really important for us to all grasp that concept, is how I think and how I feel will really turn around and say how I'm going to cope and handle my pain. So social pain is actually as important as physical pain. We've got lots of great comments in the chats that Christine is just going to read one by one, and we'll make some comments on them. So thank you.
So one person mentioned social adjustment of losing a husband after 61 years.
I actually have personal experience about this one right now. I'm supporting my mother, who is 85 years old. She just lost her husband, my dad, this year, and he was 91. So they have been married 69 years. It would have been in September, and he passed in August. So social pain absolutely is about the continual losses that people have throughout their lives. It can be very, when you're young and you could lose a baby, a child, God forbid, lots of losses. And something as simple as you get older, your bubble shrinks simply because of your people that you normally would be with and connect with, they also are passing away. So social losses and losing your loved one needs a lot of support, and you need to listen to them and let them talk it through and remind them of the good times, because sometimes they're focusing on that actual loss at that moment and reminding them of the happy 69 years that they did have together. So that's definitely needs a lot of support.
One comment says, disconnect from loved ones re-COVID, concern for later in life care, and where and who will provide this?
So we did talk a little bit about COVID, but we're all feeling a crunch. I work in long-term care, so it's really difficult when you have families that have 6 to 9 children. The designated person's only one person's allowed to visit right now. So it's making those virtual visits, which we're doing in long-term care, which is being supportive. It's being able to meet with them and phone them, give them a letter. Even if they can't read it, someone can read it to them. Sending them a card. For my mom right now, I'm sending her flowers once a month, and I will hear about those flowers for a full week. She's just so excited to get something different and something new. So it's doing those little things that make them happy, to keep them, that they're not socially isolated.
One comment says, very isolated. Because mom is so frail, she really only gets to see me. And because I can't risk bringing home the virus to mom, I can't work either. So we only have each other. But we use the phone, but she can no longer figure out how to dial. So she needs her help. She needs my help with that.
So absolutely. Unfortunately, as we age, we get lovely diagnoses such as macular degeneration, so we can't see very good or we can't hear very well anymore. So all those losses are making it very challenging. And then we add COVID, which really isolates us. So again, it's making that connection, helping her, as you said, with the phone, turning up the volume as loud as it can so she can hear, and making that connection. Prior to my father's death, I didn't speak to my mother every day, but lately it's every day. It could be 10 minutes, but she's feeling very socially isolated right now due to COVID. And again, at her age, everyone's protecting her, but that only causes more social isolation. So she has rheumatoid arthritis, and her pain's actually worse. And I know it's more because of the emotional, what she's going through, not that her arthritis medication's failing her. So we're trying to all support her more. And that's what you can do is, the other part that you made a good point is that because you're protecting your mom right now, you're actually feeling social isolation and causing social pain to yourself because you're not able to work right now. So very much, you got to take care of yourself too, to make sure that your tank is full so you can therefore take care of mom too at the same time.
We have similar messages saying adjusting to the new COVID world and missing connecting, feeling like a burden, feeling disconnected and defeated.
So that's some of the big things around social pain, is feeling that disconnect and feeling that you're a burden. My mother tells me on a regular basis, Tara, I know you're really busy. I don't want to burden you. And what I need to do, and that's what you need to do, is not negate how they feel. And just keep reiterating, Mom, I enjoy talking to you. I enjoy spending time with you. You are making me feel happy. And that way they're not feeling that burden. But I'm the first one to go, oh, Mom, a call's coming in, I gotta go. And she's like, okay. Like, she understands that, yes, we have busy lives, but that phone call, 5 minutes, doesn't have to be an hour out of your day. It could be 5 minutes, makes them feel that they are valued and loved and not a burden to us. So absolutely keep communicating.
And one last comment here, close friend in a nursing home, and we cannot touch or bring seasonal food to share from the garden with COVID. So I'm assuming meeting from the garden.
Right. So again, every nursing home runs things a little bit differently. So I actually have my mother-in-law in a nursing home right now, and not in mine, but in a different one. And she's got a sweet tooth. And it's really frustrating right now that I'm not allowed to bring in her favorite, which is a strawberry sundae from Dairy Queen. So I feel your pain. It's really difficult. But what I do know is that her weight is stable. She's not losing weight because I stopped bringing in her treats. So that's really important to me. So I know that she's stable. But there is ways around this. And I'm honest, is bringing in something that they can enjoy during the visit that you're having, something that is wipe downable. So we were able to get around that. No, I can't leave something in the fridge and all that. But what I can do is give her a little treat while I'm there. She consumes it right there and then. And that's one way to get around this lovely COVID rules that we seem to think that all of a sudden every food has germs on it. So it just has to be something that can be wiped down, but it's a great way to get around it. And the staff are thinking outside the box all the time of how to support your loved one through this. So my message is don't give up, keep trying. Absolutely. Perfect. So thank you for that. Really good communication and really understanding how important social pain is around how it affects your physical pain. It's Christine, sorry, it's not clicking. I'm clicking wrong. There we go. Thank you. So thinking about social pain, isolation, we talked about this, not wanting to bother others and not wanting to reach out. So that only adds to their loneliness. You know, your parents are always thinking, oh, they're so busy. They have to look after their family. And my mother still worries about that, even though my children are all adults. But she's worried about that all the time. So it's always reminding them we want to spend special time with them. And by worrying and having that isolation, it all affects their ability to cope with pain. But also we talked a bit about not feeling productive. So yes, it could be that we're no longer working and being able to contribute to work, but as those losses keep piling up, so you're not able to work anymore, not able to bring that income in. And believe it or not, my mother at 85 still talks about, you know, oh, I wish I could make some money. And even though she's got really good pensions and she's not, you know, struggling financially, she still doesn't feel that she's valued and doing enough. But it's also about not being able to keep up with your yard work. Then it's not being able to take care of your home. And that's really embarrassing and difficult. So we have to let them know it makes me feel useful to be able to tidy up for you. And the final social pain is when you're really not able to take care of yourself anymore. So I want to talk about the spiritual aspects and how that can affect your concept around pain. So spiritual pain is broken up into 4 levels. So there's meaning, forgiveness, relatedness, and hope, and having hope. So the meaning around life can always struggle with us. So that could be about past relationships, whether they were good or bad. It also could be around your meaning and how you feel that your life was. What did you feel that you contributed? Did you feel that you had a fair and long life? It's also thinking about your spiritual pain is around forgiveness. That's also around good relationships, could have been bad relationships. It can be your spiritual, what you believe in God, and feeling that you need to cope with how has God affected your belief system around your life-limiting illness. But it's also about relatedness. So that's dealing with your relationships, very much so that you currently have, or relationships that you don't currently have, but you wish that you had had better closure with them. So it's always thinking about how your life has run the whole gamut, but it's also thinking about hope. And hope is a very important part. Hope makes me feel that I can get up in the day and have a good day. If I've had a really bad day today, hope will tell me and make me go, it's okay, today's done. Tomorrow is a brand new day and I can start fresh again. So hope really helps you be able to cope with your pain that you're having. But if you are losing hope and you are feeling that it's really affecting your emotional well-being, it's really going to affect how you cope with your physical pain. So let's talk about psychological aspects. So that can be very situational. In the situation that you're in, I pinch you, you're thinking, oh, she pinched me and I'm angry. And why did she do that? Now I'm not going to look at her. I'm going to be angry. And you go through that psychological talk in your head. And then you add the lovely dementia component to people's lives. And that's where the filter falls off. So they verbally say nasty things about the person that they would have always kept in their brain. So I have it often that family would go, my mother never spoke like that. And I go, absolutely. Your mother verbally did not, but in her head, we all think it. We think, oh, that person made me very mad. I don't like that person. But we don't think it. We just put on a smile and go, that's okay. And we walk away and we think angry thoughts. But when you have that dementia component, the filter's broken, that part of the brain. So it's verbally coming out now. And it's really hard for children to listen to their loved ones, maybe use foul language they've never used before. And that's because emotionally and psychologically, we've always thought those nasty thoughts, but we've been taught to keep them quiet and keep them inside. So it does affect us as seniors, as unfortunately, if they're dealing with that experience, then it turns around and affects their emotional pain and their physical pain. So also psychological factors can be the ability to pay attention. And so that is a nice sign to be able to track someone's pain level is normally they love to play crib. And they can do it, they can still do it and play really good. But now you're noticing they're not focusing as well. That's a sign that they could be having some physical pain and they're just not able to keep that attention span anymore. So it's another way to keep an eye out that are they having some pain. It's also thinking around control. We all want to have control. We all control our bodies. We control our thoughts. We control our feelings. And we're really worried about not having that control at end of life. It's also our expectations. We expect that we are the monarch of the family maybe, and that we've held our family all together. And what happens when I'm not in that picture or I'm not able to perform and look after the house and look after the children? So it puts a lot of perceptions into how our pain's going to be when we think of our psychological level. So what influences our perception of pain? So this is a really important part, is your past experiences. That will really play a very large percent of how we're going to cope in the future with our pain. If you're a lucky camper that's gone through life and never broke a bone, for men that have never gone through labor, that have never had any really major surgeries or anything to cause pain, a lot of people can make it into quite older years and go, I don't know, understand. And if you don't understand your own pain, it's really hard to support and take care of someone else that is having pain. But you'll hear people describe themselves as having a high or a low pain tolerance, and that's based on their past experiences. So my husband's a mechanic. He has the highest pain threshold I've ever seen in a person. He'll come home and he'll have bleeding, old blood dried on him. And I'm like, what'd you do? And he goes, oh, I don't know. I'm like, how do you not know you have dried blood on you? Nope, doesn't even phase on him. I can tell you I have a very low pain tolerance. I would tell you exactly, I would have to phone all my family and tell them that I have a bobo and that it's bleeding and I'm going to have to take a week off of work now because I have a bobo. So I had my flu shot this week and I let everybody know, I got the flu shot and my arm is really sore. So people have that perception of whether you have a low pain tolerance or a high pain tolerance. So when I'm working through that and dealing with pain, people know that Tara doesn't have a lot of pain tolerance. She's going to be very emotional about it. But then you meet other people like my husband that literally goes through life. And I'm like, really? Doesn't that hurt? No, he's chronic pain. And I don't think I would be able to cope and work and do everything he does. But he's able to because he has a difference. And unfortunately, it's not something that is learned. It is not something that you can control because it's how his body sends those nerves to his brain and how his brain reacts to it. And unfortunately, for some of us, we don't have that ability to cope as well. And that's okay because we have to listen to the person of how they express their pain. So what are some of the consequences of having persistent pain? So someone that's a life-limiting illness or someone that's having chronic pain, some of the things that they absolutely need to be watched out for is number one is depression. Nothing is worse is getting up every day and having that pain and knowing that it's going to be there. And the more you do, and the more you use your body, and the longer the day lasts, is the more that you could be feeling that pain. And that alone can bring in some sadness, and it can bring in some loneliness. And those are the signs of the people that normally would be upbeat people, but now they're very flat. They're just sitting there and they're really not engaging. They love TV. They love watching TV. Now it's just on. They're really not paying attention. So always have that good conversation with your physician to go, you know what, I'm really noticing it with my loved one, that things that they always enjoyed, they're not enjoying now. And that's a true sign that there could be some depression happening. Anxiety can be very debilitating with chronic pain. I know if I get up and move, it's going to cause pain. So I get anxious about before I ever have to get up. So I become very anxious. And you can watch that. You can watch the tensing of the body. You can watch the increase in the breathing. And you can watch them. They'll talk about it and go, oh, I need to get up to the bathroom. Oh, well, let me help you. I don't think I'm ready yet. Maybe a little bit. And it's a point that they're worried that it is going to cause pain. So anxiety can be very debilitating. Again, you need to talk to your physician about that, because again, there's some pretty good things out there that can help anxiety. It also can affect your appetite. All you have to do is think of the time that you had that toothache and you literally thought, I can't eat, I can't drink, it hurts too much. So absolutely, pain can affect our ability to eat. So what we can do as caregivers is make sure that we address pain medication before the meal, not during the meal. It's too late then. You got to go, okay, it's an hour before supper. How are we doing? Use the 1 to 10. How's your pain doing? Oh, it's about a 2. Awesome. Let's give a little dose now. Oh, I think I'm fine. But an hour from now, when they actually have to eat, it's now maybe a 6. And now it's too late and they're not as hungry. So it's always a good idea to deal with pain medication a good hour before actual meal time is happening. And it goes back to the adage that Noelle talked about, small, frequent meals. You know, we're so much into the breakfast, lunch, and supper. Well, no, let's do 6 to 8 and do small little snacks. And that could really help keep the calorie intake up. But it's also can cause us decreased socialization. So as I told you, my mom has rheumatoid arthritis. If her pain's a bad day before COVID, she's like, no, I didn't go out today. Pain's bad. So it causes them to not being able to want to get out, or not wanting to visit, and not wanting to socialize. So it absolutely can cause that emotionalness that, you know what, I'm not going to move. I'm going to stay home. In the end, does it change their pain? No, it doesn't. Unfortunately, it doesn't make it worse, doesn't make it better, but it can. What can that help them? It can help their emotional well-being, to help them be able to be socialized and therefore actually cope better with their pain. It also, persistent pain can affect their sleep disturbances. So normally people, as they get older, will sleep more and more, and but pain will absolutely interrupt that. It's totally okay to have naps. And that's something that is important, to be able to always play catch up. That's one thing the body will always do, is play catch up with pain. But not being able to sleep due to the pain, that's a hint, is making sure that, again, pain medication is addressed at least an hour before bedtime, and making sure that they're really comfortable, because they're going to tell you the same thing. Oh, no, it's a 2. It's really good right now. But in the middle of the night, it's climbed up to a 6 and it wakes them up. So don't hesitate to consider good pain control an hour before bedtime. And also, finally, it'll affect the ability to get up and move. And ambulation can really be affected by their pain. A lot of people will guard, so they'll keep their arms in. That puts them at risk for falls, because they're not using their arms to swing when they walk. So again, it's watching the monitoring and making sure that a well-rounded pain regime is occurring 24 hours a day. So I talk about this a little bit more in my next presentation, but I just wanted to give you some hints of what to be watching for your loved one or yourself if you're having any pain. So the face is the mirror to your soul, and it's so true, is that look for your face. when I'm taking care of you, when I'm turning you, when I'm assisting you or transferring or giving you a meal, watch the face. It will be the true mirror of what that body's feeling inside. So look for frowning and looking frightened. It could be grimacing or wincing or keeping their eyes tightly closed, or something simple is rapid blinking. So your loved one will say, no, I'm fine. I'm not having any pain. And then they go to move and you see that little, oh, watch for the little squinching of the eyes. That's signs that it really isn't as comfortable as they were hoping it was going to be. And there's nothing wrong with doing a check-in again and going, hey, I notice that I see it in your face. Could I please give you something to keep you comfortable? So it's watching that face is the one thing that people can't mask is what your face is doing. So look for vocalizing. Some people are very vocal, some people aren't at all, but you want to watch for that. So it could be the common, you're going to see the big red herrings will be the moaning or the groaning or sighing or grunting or chanting or calling out. But also watch for increase in breathing. That's a hint that, I'm working harder and that I could be having pain. And as I talked about early, it could be verbally abusive. And you go to touch me and I'm like, oh, why'd you do that? And they're like, you can hear the tone. It's the tone they're using. And it's not really about you. It's I'm having pain right now. And it's one way they can express it is the tone. It's not the happy-go-lucky person that you always know. This person is sharp and staccato and going boom, boom, boom. And you're like, that's not the normal loved one that I know. It's a sign that they could be having pain. It's watching the body. The body will keep itself rigid. It'll keep themselves tight. They'll keep their arms in. As I told you earlier, the man that's rubbing his belly, we will rub areas that ache and make us sore. But also watch for the movement. It could be, I want to get up and I want to walk around. Are you okay? I'm fine. Are you having pain? Nope. And you're like, but you're not sitting down. Why are you moving? Where are you going? I have to go to the kitchen. I need something. Oh, can I get you something? No, I'm fine. So it's that, okay, I don't get it. Where are they going? What are they doing? It's not making sense. And it could be that they're having pain and moving. They're hoping will make it better. It might not, but it's always doing that check-in and going, hey, I notice that you're walking around and, are you having pain? And always use a scale 1 to 10. And when it's a 2, we've got to be doing something about it. But look at change in routines, such as not wanting to eat, being up during the night. As I said about the cards and not willing to do things that they really enjoy doing. And they can still do it, but they're not enjoying it now. So watch for changes that are happening. But also watch for the mental status. So watch for increased confusion, not necessarily because of the pain medication, but they're not able to focus because it takes a lot of energy to think about the pain and control the pain and go, I'm not going to worry about it. It's not that bad. They have mental talks in their head all the time about the pain. So they're not able to focus and carry on in the conversation. And you'll hear, I'm sorry, what did you say? Because they're thinking internally. So always do that check-in and go, hey, how you doing? Are you having any pain? Are you discomfort? Could we move a bit? So look at that and watch for that. So just some key things that you could be watching for your loved one. So I want to talk about, the next session is all around pain management and using traditional pain medications and stuff like that. But I want to let you know that there's so many other methods out there to help your loved one with pain. So I want to talk about acupuncture. And a couple of years ago, I actually used it for the very first time. And I did some yard work with my daughter. And I thought, I'm superwoman. I am so healthy. And sure enough, I hurt my shoulder, but it never got better. And someone said, you should try acupuncture. Remember, I have a very low pain tolerance. I'm like, poking needles? No, I do not think so. No. And they're like, you need to give it a try. And I went, fine. It was a miracle. I came out of there with no pain after the very first session. Yes, I needed a few more sessions, but it was a miracle. And so if you've never tried it and think, oh, I don't like needles, trust me, the needles were so minute and I psychologically talk myself out of it. It had to talk myself into doing it. But acupuncture is a great way if they're having pain in a certain area. And it's quite affordable, actually. It's not that bad. So it's another a great program that is not used as much as it could be. And it's a great program. So you need to try it out. Number one in my world is massage therapy. And that doesn't mean that you need to go to a masseuse, even though that is amazing and makes you feel like $1,000,000. But at the end of the day, when you're tense and you're sore, just giving someone that back rub, you can see their shoulders drop. It can really help those nerves that are sending that message to the brain to go, oh, I feel more relaxed. Takes those tense muscles and puts them into relax mode. It's the one thing you can always do for your loved one is gentle massage and make them feel more relaxed. It'll help sleeping, helps their mood, can help their intake. So massage therapy, never forget that is, you're always like, what could I do for them? That is one thing we can always do that costs no money. And you can do it at any time. Vibration massage therapy can be effective, absolutely. As same with medications, it's go low and start slow. So don't start on level 5 of the machine, start at level 1, but give it a try. It could really help people that are really having some good muscle or bone pain. Sometimes that will just help relax them. Physical therapy, for anyone that has had it, you're going, wow, I was sore, but then I got better. And massage, physical therapy can absolutely help the body for specific areas. And again, it's more about massage therapy and can really help you learn some good exercises that could help. My second one that I always tote is good old heat therapy. For residents that are older, heat therapy can make them feel like $1,000,000, helps people's mood so much. But what's important around heat therapy, though, is if your parent still has that very old electric plug-in heat pad that doesn't shut off and keeps the heat at the same temperature, you got to throw it away. Buy them a brand new one. And the new ones are all CSA approved that the temperature will shut off. Because seniors have had some serious burns due to electrical heat therapy. But there's nothing more than just putting them on their achy knees and they'll go, oh, that feels good. So heat therapy is a great way to make emotionally their pain better too. Cold therapy can work. I don't like cold, I'm honest. Don't like it at the best of times, but when you're truly having that ache and pain, and they're describing it as aching, try the alternating heat and cold. It can help people. But remember, cold therapy doesn't have to be that really cold ice pack that you just took out of the freezer. It could just be a cool cloth that would really help. Nothing helps anyone better when you're having a headache. It's just putting that cool cloth on your forehead can really help take care of headaches. So think of cold therapy. Relaxation techniques, now with the beauty of computers and technology and YouTube, don't negate taking that moment and going, let's just listen to the water rushing and the relaxing and the breathing techniques. Lots of ways to help them focus out of what they're thinking inside their head about their pain and helping them focus on relaxing the body and doing it systematically. Some other ways is good old music therapy. I can't tote this one enough. I think this is my third best one. My husband, when he gets in my car, he always goes, because I love the music loud. I find a song I can sing to, and I love music therapy. It will bring good endorphins into your body by making you happy. So you need to find out before, at the beginning of life, what music does your loved one love? Is it, God forbid, rap music? Could be. What makes them happy? What brings them joy? And find that out and play it and sing with them. Even if they can only hum to it, it will give them good endorphins and that will help their pain control. So always think of music therapy. And some people believe that at end of life, it must be quiet. It does not need to be quiet. It can be loud and thumping and what makes them happy and makes their toes tap. So think of music therapy. Imagery is really important. So looking at I will use my my corgis. I have a corgi, and I love my corgi dog, the Queen's dog. And in my office, I have 2 calendars of corgis. But also, my husband bought me this cute little planter that has this cute little cactus in, and it's a corgi. I look at that corgi, and I know my mouth just smiles. It makes me happy. Imagery of what makes you happy can absolutely help. So for your loved one, something so simple is getting a Bristol board and putting pictures on of their loved ones, happy times, but you need to rotate them. So don't put it up and go, okay, that's it, I'm done. You know, maybe it's every month, maybe it's every week, and just rotating, because it brings happy memories. And again, that's good endorphins, and that will help my pain control. Relaxation breathing is so important. So I want everyone to take a minute. Why don't you close your eyes, give me a deep breath, hold it, hold it, hold it, and relax. And just by doing that, it takes your shoulders up, but it drops your shoulders down. So we don't do enough relaxation breathing. We all need to do it. It will make us less tense. It makes us cope better. So don't hesitate to use good breathing and go, Mom, just give me a good deep breath. Oh, I do it all the time. I know, Mom, come on, do it with me. And if you do it together, it'll both help you relax. Distraction, as I said, is a great one. That is all around imagery, putting those pictures up and talking about the past. When you're with your loved one, as you said, day in and day out, you're like, what else am I going to talk about today? Okay, I got to think of something. And talk about the past. Talk about, I was driving here today, and this car, it literally was supposed to be in the straight lane, but this person was in the turning lane. And we were all watching him, and we're at this light and going, oh my goodness, she's going to go through that light, but she's not turning, she's going straight. Oh my God, close your eyes. Talking about that will make them vision that. And they're like, wow, that happened. And yeah, it happened. So it's telling them simple things that happen in your day will get them out of their head and into thinking something else. And distraction is a great way to cope. I think my 5th one is really about humor. Some people are really funny. I'm not, unfortunately. But I do find little things in life. So the story of the senior going literally straight when she's in the turn lane, that really happened last week. And it was very scary at the moment. But I found the humor in it, and I'm like, oh my. And I spoke to my husband. He was with me at the time, and we were both quite scared of what was happening. But I wrote the license plate down as a concerned citizen to go, the senior should not be driving right now. That's really not a safe thing. So I found the humor in that, because it could have been a very disastrous, but all the other drivers were very alert and attentive, and nothing bad happened. But you need to find humor in things that normally could be very stressful. My final one is the TENS treatment. So that is a program that Dr. Ho has really promoted on the commercials, but that is electronic stimulation, and that program can really help. So I complained about my feet being sore after working 12-hour days at the hospital, and my husband bought me my TENS, that is a foot resting, and it causes electrical currents to my feet, and it's $1 million. I love it. It does cost some money, but for your loved ones that are having those achy, sore muscles, and their muscles are achy, the TENS treatment absolutely can be a great program. Again, the same concept is go low and go slow, because it can, you don't want to overstimulate the muscle, or that actually can cause more pain. But it is an option. So I want to go back to the chat box again, and I'd like you to tell me, what are some of the pain relieving methods you have used with your loved ones? What have you used on yourself, or what would you like to use going forward? So I've given you quite a few choices. So I would like you to put in the chat some of your ideas that you use to do alternative pain relief. So someone brought one in that I should have thought about, which is light therapy. We typically right now are in the lovely sunny Okanagan, but we know that, as Noelle talked to us last week, is vitamin D is critical for our bone health and our also our mental health. And so not every senior gets out and gets fresh air every day and gets that vitamin D. So light therapy actually can work very effective. It's not your light bulb from your lamp. Okay, so you need to know that you need to purchase the right light therapy, but that absolutely is very relaxing. Along with that, with imagery, is when you're doing that light therapy, is when you're sitting there thinking, okay, I'm on my beach. I'm sitting here, I'm getting a tan. Oh, isn't that nice and warm? So light therapy can be really good. Don't hesitate if light therapy is really irritated to your family member, is use a little goggles that you would use if you were doing sun tanning, or even sunglasses could be used. But it's a great way to protect the eyes during light therapy. So,
Talk therapy and meditation.
Perfect. So we're doing it today just by listening to me, and talking is a great way. Storytelling is a great way to make them think of what's happening and what's going on in their lives, and not be so much of the internal of what's happening to them.
We have meditation and yoga, calming music and tea, gentle stretching chair.
So I have to say that my daughter is a yoga instructor, and I'm like, I'm not very flexible. I cannot do that. And she goes, oh, yes, you can. And I've now taken up yoga, and I'm like, I'm not as bad as I thought I'd be. So gentle stretching, absolutely. First thing in the morning, if they can, is bringing those arms up above their head. What that does is stretch up their arms, stretch out their diaphragm, stretch out their breathing and their stomach, and having that gentle motion and range of motion, and at the level that they're comfortable at. But that can really help cope.
We have some similar messages here with daily back rubs, sipping hot cup of tea with a hot water bottle wrapped in a towel under their feet, listening to music, heat therapy, massage, just start on the treadmill. Most right now is 3 minutes at a time.
Perfect. So the treadmill is a great idea. I've got my 85-year-old mother on her treadmill, and she goes, oh, I've got rheumatoid arthritis. I don't think so. And I'm like, do it for a minute. And she has now slowly gotten up to 5 minutes. And it's been a very long process, but she feels so good when she's done. She goes, I speak to her and she goes, I did the treadmill today. I'm like, way to go. Or she'll go, oh, I did the treadmill. I only did 3 minutes. That's all I could cope. I'm like, oh my God, that's amazing. So every little bit helps. And we're the champions. We're the ones that keep telling them what they did was amazing. It's feeling useful. So if they're not able to do all the dishes, well, come and help me with the dishes, and they do it for 5 minutes. Then they sit down in their chair and we chat while I finish the dishes. So it's making them feel that they are part of the process, can really help cope with pain. I love the idea about tea. Tea is a great way, lots of soothing things, helps you settle down, helps your mood, helps you sleep. So a cup of tea is an awesome option. And as Noelle taught us, hydration is critical, and tea and coffee is another great way to get hydration into you.
We also have Qigong, Tai Chi, aromatherapy diffusers, light pads applied to pain areas, reflexology.
Perfect. Aromatherapy, as I touched on in my first presentation, very therapeutic. And lavender is the #1 essence that can really help people feel relaxed. Smells amazing too. But lots of different options out there. So I really love that we're not thinking end of life, I'm having pain, it's got to be a pill. A pill's going to fix everything. And a pill can help, but all these other ideas are really great ways to help you with coping with your loved one's pain level. So just a quick summary for overall, we need to talk about pain. We need to ask those good questions. We need to talk about to our loved one and go, what kind of pain have you had in the past? You know, was it that they still can go over exactly every childbirth and how that was? That they go, oh, you know, I fell off the horse and really wrecked my back years and years. Oh, I didn't know that. So it's about their pain that they've had in the past that affects their future. But always be observant of what's happening in that body and what they're showing you. So watch that face and don't hesitate when the first answer is no, I'm fine. That's very quick. Always ask more questions. Don't hesitate to do that. It's also about believing. What I think my pain is my pain. You can't tell me differently because I believe that that's what my pain is. And we've given some great options that are not around medications that can be really effective for pain control. And don't remember that touch is the number one way to connect, but the number one way to reduce someone's level of pain that they're having. So deliver interventions timely. Always think about before meals. Think about just before bed, before they actually have to go out. So if they're going out for a 10 o'clock meeting, think well around 8:30, 9 o'clock, thinking about pain control so they're comfortable and ready to go for that outing. So I want to thank everybody, and I'm going to open it up to chat. And if you have any questions now, so please take them into the chat and I'll do my best to answer them. So we just have a good question in the chat that we're just going to read out, and then we can talk about it.
How do you support a person who's unable to express where they are having chronic pain if they are resisting help?
So that's a really good one. And I'm hoping that I've given you some tools to deal with that today. So it's watching the body and really watching the physical symptoms that you could be seeing during pain. And it's really talking, and it's having those great conversations to go, you know what, Mom, I'm seeing that your face is really scrunching. I'm seeing that you're really quite tense. And making them realize that sometimes they believe being a hero means not discussing that pain and not addressing it, and letting them know that it's okay to talk about it, and let them know that, you know what, Mom, my back is bothering me. Make it about you and go, my back is bothering me right now. So I really found that when I massage my back, it really makes it feel better. Could I try that with you? And trying things that you can convince them to keep talking about it and going, hopefully they'll open up to you, and hopefully that they'll agree to the back massage, or trying the heat pad and go, Mom, my knees are quite achy today. And you know what I did? I put a heat pack on my knees and it made my knees feel better. Could we try that with you? And the final way that you convince your loved ones is always going about you. Go, Mom, I really feel I need to do something for you. I want to feel useful. I want to help you. And Mom, I want to be that I'm doing something good for you because I love you. And you love me, right? Yeah. Oh, yeah. Let's do this together. So it's convincing them. And you can use that technique for everything. If you're trying to get them to go to the bathroom and they don't want to go, or you want them to go out of the house and they don't want to go out. So always bring it around to you and go how you're feeling or how you're coping. And could they try that too? So some good techniques that has worked very effectively for me in my career with my dementia clients is someone that loves to walk and walk and walk, and we should sit down. Your feet have to be sore. No, I don't want to sit. But you make it about you and go, my feet are killing me. I'm really tired. Could we just sit down for a minute? Okay. They'll sit with you thinking that it's about you, but meanwhile, you're getting them to sit down and have that reset. Any other questions?
One person says here, should you resist the urge to cry? Does crying make it better or worse?
So let's go back to what we talked about is having a high pain tolerance or having a low pain tolerance. So as I communicated, I'm low, I'm a crier. Oh, I had my flu shot. I'm like, okay, don't cry. Oh, no, there goes the tears. The tears are happening. And I warned the pharmacist who did it because I knew him. And I went, Okay, I'm not going to pass out, I promise you that, but I will cry. Nothing wrong with crying, because that helps our emotional coping level. And if they're not criers, you can't make people cry that aren't crying people. But if they are crying, you need to love them and encourage them and go, it's okay. It actually will help your pain level by expressing that emotion, because keeping it bottled up only makes them more emotionally tense, it makes them more physically tense, and it can actually make their pain worse. So that's a really good question.
I think that's fair to say for the caregivers as well, too.
Absolutely. And nothing wrong with crying in front of your loved one to go, these are tears of joy. These are tears of frustration. Being honest and going, I'm struggling, but I'm here and I love you and I don't want to miss out on this. But letting them know that you are coping, but a way to cope is by crying, and that's absolutely acceptable.
One more question here that says, my husband has polymyalgic rheumatica and peripheral artery disease, as well as rheumatoid arthritis. He feels severe weakness always in his legs. Would acupuncture help that?
So I would always go to your physician. It is my number one go-to, because that person knows the age, the diagnosis, and everything you're dealing with, what medications you're taking at that time. So always go to your doctor and go, I talked to someone and they thought acupuncture might be an option. What do you think? And always go with your physician's advice. And hopefully they are a physician that's very open to trying anything. And I'm a firm believer, try it once, because initially I was like, don't like pain, don't like needles. Can't imagine how pain is going to help my pain get better. And it did a miracle. And it was about muscles. So peripheral vascular disease is lack of circulation. And your fibromyalgia absolutely is affecting the muscles. I would say absolutely. As a nurse, I would certainly say I think it's worth a try. But when you do go in, because it is a physician that does acupuncture, it's not just a technician, it is the actual physician. They check out, and literally it was pages and pages of questions I had to answer of everything that could be going on in my body. So you would definitely have a really good assessment, and the acupuncturist would be able to say, yes, I would be able to help you with the disease that you're having. So absolutely, in my opinion, I would give it worth a try. No harm, no foul, that's for sure.
What about CBD?
So that is a really good. So CBD is the lovely component that is in cannabis. And on November the 21st, yes, is my next talk. And it's when we talk about pain control. And I'm pulling in the pharmacy that I work with all the time, which is CareRx. And they're giving us a really good presentation about cannabis and all the options it can provide for pain control. And I can tell you that my husband, with his arthritis, gave it a try, and it's actually helped him. He's on less traditional pain medication now, and he still functions and drives and works. And so, yes, there's a lot of new technology that's coming out and information around cannabis usage and how that helps. And there's a lot of people that are end of life that are on chemotherapy medication that are actually trying it now that go, I don't want to smoke it. And my hairdresser, her mom is going through breast cancer treatment right now. And now it's just gone systemic. And now she is using CBD oil, and it's helping her very much with her nausea. So lots of different ways to handle pain medication. So do come in to November 21st and have that great talk. And pharmacy is much more of an expert than I ever am on the traditional use of cannabis.
One last comment around that is that it could help anxiety as well.
Oh, absolutely. and it helps appetite. So it is the old adage that people that used to smoke marijuana, they're like, they had the munchies. So it's true. It actually does improve the appetite for people, which could be very difficult if you're going through chemotherapy and end-of-life illnesses. Appetite is really difficult. So getting the munchies through using cannabis can actually be very helpful. Also, as you said, very much to help reduce people's anxiety. Awesome. So I just want to finish off with my good old Charlie Brown. I use Charlie Brown a lot because I grew up watching the comics around Charlie Brown, but some really good quotes. And I love this one. Life isn't meant to be easy. It's meant to be lived. And sometimes it's happy and other times it can be rough. But with every up and down, you learn lessons to make you strong. So I'm hoping that today's message gave you some more key tips of how to understand pain and some great ideas of how to cope better with pain. And that you are, as a caregiver, you don't always have to be strong. Every day is up and down, and you're doing the best you can, and your loved one is going to know that love and that you need to take care of you at the same time, because if your cup's not full, then you can't give any to anybody else. So do take care of yourself, and thank you for your time.